Greetings. I am Patricia Peat and I run Cancer Options Consultancy, and I'm very pleased and proud to be sponsoring and promoting Metabolic Health Day, this much needed initiative by Dr. Naisha Winters and her brilliant team. I set up Cancer Options many years ago now after working in oncology, where I saw our treatments causing people to become metabolically sick, cachexic, fatigued, suppressed immune systems, and unfortunately, frequently beyond the point of where the body had a chance of repairing itself, let alone managing to deal with cancer once the treatment stopped. Our response to that was nothing. There is nothing you can do to help yourself. You have no power in this situation. Please just accept. This is how we deal with cancer. I came to ask myself, were we making a positive impact for them? And again, frequently, I felt the answer was not. It was possibly more detrimental and not a situation that I was comfortable with. With metabolic health, over the years, I have watched, as we all have, the increase in environmental toxins, the decrease in quality of nutrition, where we fill our shops and supermarkets with junk food, and our lifestyles that are combined, that have accumulated in a massive increase in chronic illnesses of all kinds. We've allowed the creation of healthcare, that's slightly ironic, systems that actually do nothing to promote good metabolic health. They promote dependence on pharmaceuticals with no education or support to any individual on how to be metabolically healthy. It just creates a vicious circle of sickness. And we've got healthcare professionals who spend so many years training, and at the end, they know little about what a metabolically health person is. I recently had an oncologist look at some methylation pathways on one of my clients. He was pleased to. He said he hadn't looked at methylation pathways since he was at medical school, and my client has breast cancer. We've got governments who don't care about metabolic health. They're quite happy to allow the proliferation of junk food and suppression of good food. I find it bizarre that when healthy initiatives come along, the media often treat them as being slightly freakish. What those weird people are doing now when they could be eating burgers and pizzas. And our governments just allow the pharmaceutical answers to proliferate. I don't think the medical world has any intention on helping people become metabolically healthy in any true sense. And our governments don't either. This system and the people in charge of it are content to watch physical and mental health deteriorate across the board. Chronic disease increasing in all areas, quality of life and lifespan decreasing. We allow contamination of our food chains and lifestyles with no thought for the consequences. Our kids aren't taught how to cook. They aren't taught that what they're eating is crap and the effect it's going to have on their bodies and their future health. They aren't taught the simple things of how to cook a nutritious meal. We aren't teaching our children how to live. We are teaching them how to become ill and to die earlier. So Metabolic Health Day is about a massive shift in that process. It's not to give it a nudge along the road. Look at Naisha Winters' passion for this. It's to change healthcare because we actually have to. We actually need and deserve to allow people to have the necessary education and tools to take control of their health and to become medically, physically, mentally, emotionally healthy by embracing everything about metabolic health. And it's about a revolution. We all need to get on board with this to fundamentally change this terrible approach that we have to life and to healthcare, and to put these person at the center of the process, not the disease process. We actually have got to stop and reset our whole way of thinking and living to correct this terrible way that we have set things up. It's a real emperor has no clothes situation. Everyone accepts it as normal. And that absolutely has to change to give everybody the opportunity for the good metabolic health that they deserve. I'll be joining in Metabolic Health Day, and we all need to work together to ensure that we have these goals in our sights, so that for, people today, our kids in the future, every day becomes a metabolic health day. See you there.